seen as the strengths and weaknesses of humanistic perspectives. First, the strengths. For one thing, they emphasize the whole person, and they see people as free and responsible. In other words, humanistic existential perspectives emphasize people as free agents who make choices. And this places these perspectives in stark contrast with perspectives that view abnormality as reducible to biology, to conditioning, to irrational thinking, or to social factors. This can seem highly refreshing, especially compared to approaches that see people as ill or as victims of circumstances. 2. They emphasize people as unique. Humanistic and existential approaches do see people as unique. They carefully attend to each person's problems, and they have a strong disinclination to lumping people together into diagnostic categories. And this is often seen as a big strength of humanistic existential viewpoints. 3. Their impact on therapy. Person-centered narrative therapies have been really influential. Humanistic, early use of face-to-face weekly sessions quickly eclipsed psychoanalytic practice of daily sessions with patients on a couch. Most therapy approaches today have adopted Carl Rogers' emphasis on providing a very supportive and safe environment for clients to explore their issues. We often don't even see that as simply humanistic. We see that as just what therapy does. What about their weaknesses? For one thing, humanistic approaches are sometimes seen as unscientific. Their critics complain that they emphasize free will too much and that this runs counter to a scientific determinism. Because people are active agents, humanists argue that psychology has to develop human science methods to effectively study them. However, critics of humanistic approaches say that throughout its history, the humanistic existential perspective has really rejected science and subjecting its ideas to proper scientific inquiry. 2. Inadequate treatment for serious disorders. Some critics do say that humanistic existential perspectives are fine when working with everyday problems in living, but they're seriously inadequate for conceptualizing and treating serious mental disorders, such as schizophrenia and bipolar disorder. And a third criticism is that humanistic perspectives are too individualistic. That is, they've been critiqued for overemphasizing the individual in a way that sometimes inadvertently encourages self-absorption and ethnocentrism. Some people complain that humanistic approaches reflect Western biases in this regard, the goal of helping people fulfill their full potential, even when it conflicts with social expectations, fits with the emphasis in the West on individualism. But this may be inappropriate or even counterproductive when we're working with clients from more communal cultures. So that's a little bit about the strengths and weaknesses of humanistic approaches. How do you feel about them?